Hello friends, I'm Dr. Anurag Shrimal, liver, kidney, pancreas, intestine transplant surgeon and currently practicing at Mumbai. My area of specialization includes adult and pediatric liver transplantation, kidney transplantation, pancreas transplantation, intestine transplantation and complex hepatobiliary surgery. Today I'm going to talk to you about the liver transplant surgery, who needs a liver transplant, what are the various forms where a liver transplant can be done, and how is life after liver transplantation? These are very common questions that I face during my meetings with all my patients and their families. So let's start with the first question. What is a liver transplant? Liver transplant is a surgery where the entire liver or the entire affected liver, diseased liver, is removed from the patient's body and a healthy liver is put inside the patient's body. In this process, first we remove the liver, we put the new liver in, and we make connections of the blood vessels, of the bile ducts. The moment the blood flow is re-established, this new liver starts working and we can see parameters changing in the patient immediately after what is called as reperfusion. Not just one of the most complex, this is the most complex surgery in a human body, that is living donor liver transplantation surgery. The question comes next is, who needs a liver transplant? Now there are multitude of conditions where a patient would need liver transplant. We can broadly divide them into two categories. One, what is called as an elective liver transplant, and one, what is called as a emergency or a super urgent liver transplantation. Coming to the first part of it, which is a elective liver transplant. Now these are patients who would be either walking from home or who are admitted at the hospital being stabilized and then undergo a liver transplant operation. The common conditions or the common diseases where a patient may need liver transplant includes, we are the diabetes or we are the fatty liver capital of the world now. So the most common condition is metabolic or NASH related cirrhosis of liver. Because of long-term accumulation of fat and the toxicity associated with it, the liver is damaged and it becomes shrunken, hard, nodular, and this condition is called as cirrhosis of liver. When a patient starts developing complications of cirrhosis, they need a transplant. So friends, children are not miniature adults, they are different, and hence the diseases that affect children are very different. Some of the liver diseases can be treated medically, but once the medicines fail to treat them, they require a liver transplantation. Various indications for pediatric liver transplantation. The most common indication is what is called as biliary atresia. Now, biliary atresia is a disease where from birth the bile duct, the gallbladder and the bile duct or the biliary apparatus is not formed in this group of patients. Some of them are lucky and they are offered a surgery, what is called as the Kasai portoenterostomy. And if that surgery is done within the first 90 days of life, around 40 to 60% of them will have a successful outcome and will grow up to teen or adult. So the most common indication for pediatric liver transplantation is biliary atresia. The second common indication is metabolic liver diseases or genetic liver diseases like PFIC. In India, we see it very common. We have something called as Wilson's disease. It's a disease where the liver is not producing ceruloplasmin, a protein that is essential for excretion of copper from our body. And hence, copper accumulates in our body, it hurts the liver as well as other organs. When it hurts the liver predominantly, it is called as hepatic Wilson's. When it hurts the brain predominantly, it is called as neuro-Wilson's. But remember, in both the set of the patient, it is predominantly an organ, but rest of organs are always affected. Some of the patients who have got Wilson's disease may develop a severe liver dysfunction with an infection, and that's called as Wilson's crisis, and they would need an emergency liver transplant. So friends, we talked about biliary atresia, we talked about the cholestatic liver disease like PFIC or Alagille syndrome, we talked about inherited liver diseases like Wilson's disease, but there is a whole array of metabolic liver diseases. Now remember friends, liver is the site of synthesis of a lot of enzymes that are needed in our body. And if these enzymes are not working or are deficient from our body, it would lead to certain form of disorders. So metabolic liver diseases includes urea cycle defects, organic acidemias, as well as a multitude of liver disorders or a multitude of metabolic liver disorders where liver transplantation will be curative for them. The last group of this disorders is what is called as acute liver failure. In children, acute liver failure may be because of various etiologies, but the most common is indeterminate, where we are not able to determine what caused this acute liver failure. But a healthy child develops a severe form of liver injury, and that progresses to jaundice, that progresses to altered sensorium, that's called as hepatic encephalopathy. And as the liver is not able to synthesize the liver proteins, that leads to thinning of blood or coagulopathy. So this combination of form of liver injury associated with jaundice, hepatic encephalopathy and coagulopathy in these children is defined as acute liver failure. Few of them would recover with medical management, but a majority of them would require a liver transplantation. So friends, whether it is biliary atresia, other cholestatic liver diseases, metabolic liver diseases, Wilson's disease or acute liver failure, these children do very well with a liver transplant. One more indication which is very special to the children is a liver tumor that is called as hepatoblastoma. Now, hepatoblastoma is a tumor which is seen mostly or almost always in the small children. This is a tumor which is very sensitive to chemotherapy. If treated appropriately, even with the advanced stages of cancer, sometimes what we call as stage 3 or stage 4 of this cancer, these patients or majority of these children can be cured with a combination of surgery, either in the form of liver resection or liver transplantation and chemotherapy, and most of them will live a healthy, productive, long life. Friends, thank you for watching my video. Do subscribe for important information and updates about liver health and liver diseases. Don't forget to like my video. Thank you for watching.